Hello! Today we're going to talk about partial dentures. If you have partial dentures, these are some clues for you, and this will help you be healthier. So, what are partial dentures? They're removable appliances, prosthodontics, that can help you to hold your teeth in place, and they can help to give you a little bit of chewing ability and also support your face and cheek structures. So if you have a partial, you have some natural teeth in your mouth. So these little clasps you see here and here, they fit on your teeth, around your natural teeth. So this is where a partial and denture are much different. So we want to make sure that we understand the partials, how to take care of them, the pros and cons of partials, because partials are one way to replace missing teeth. So replacing your teeth is important. This is one of the options to do that. So what is a partial denture? We talked about that. Pros of a partial denture is that it is removable, is usually less expensive than an implant or a fixed bridge, and that's pretty much it. So so the things about the dentures that are not as desirable is that you have to remove them every time you eat something or drink something. You want to take them out, rinse the partial off, and rinse your mouth out. Your natural teeth will hold, the bacteria will hold on to those natural teeth around these clasps you see, and that will cause you to get decay around your natural teeth. And it will also hold food and sugar and acids there. So one of the cons is these have to be removed every time you eat or drink anything, which is important. You have to take them out and clean them separate from your natural teeth. We're going to talk about that in a few minutes. So these are just a few things. If you're trying to figure out if a partial denture is good for you, these are some important information that will help you. All right, so there's different types. This picture here, you can see the metal on the partial versus the all acrylic except for the clasp. So there are two different types. There are acrylic ones that actually have acrylic on the part that fit the clasp that fits around the tooth. I just don't have a picture of that. The good thing about the metal in your mouth is that it helps to make you feel like you feel heat and cold, which is what you're used to, especially on the palate. But the metalless, the acrylic, all acrylic ones are really more comfortable and more aesthetic, so they look a little bit nicer in your mouth. So that's important to know too. All right, so cleaning your partial. How do you clean your partial? You have a cup that you put it in with the with the Polydent. You've all seen that. But what if you don't like to use the Polydent, or what if you're out of Polydent that night and you need to clean your teeth? One good way to do that for your partial dentures is to take some baking soda and put it in some cool to warm water, not hot water, but cool to warm water, and that will help you to clean your teeth. So after you let it sit in that all night, 4 to 6 hours at least, while your gums rest, then you brush it with your brush. So this brush is going to not be your toothbrush, your soft toothbrush. It's going to need to be a medium bristle brush, a little bit stiffer brush, because you want to brush that plaque and bacteria off once you soften it up after it soaks all night. So that's important to know as well. So you can also use, when you rinse it, we want to make sure that you put water in the sink so that if you drop it, it doesn't break. Teeth can break off the partial, you can damage the clasp, so water in the sink is very, very important. Now I mentioned warm or cool water. Never put your denture in hot water. That can distort it, especially if you have an acrylic denture. That can really make it distorted for you, so understand that as well. So we mentioned a partial. Partial is going to fit around your natural teeth, so you still have to clean around your natural teeth. So you still would want to brush your teeth. I don't know how many you have or would have, but you still want to brush your teeth for at least 2 minutes if you can. Even if you don't have a full dentition, brushing for a little bit longer is not going to help you. So a full mouth of teeth or a little bit, still 2 minutes, twice a day. At the gum line is very, very helpful and important. Cleaning around underneath the gums helps you. If you lose your natural teeth, then you will not be able to have a partial denture. It's got to have something to hold on to, so remember that and how important that is. So your teeth still need the nutrients. They still need good food. They still need to be cleaned daily. Your natural teeth do as well. All right, so you always want to remove them when you eat. After you eat, when you're resting, you want your gums to rest every single night. It's really important. It's like letting your feet rest from your socks or your body rest from your clothing. It's very important. And if you have a sore or ulcer in your mouth, if you have a sore or ulcer in your mouth, warm salt water rinses are really good. as well as peroxide in that localized area can really help that to heal as well, and even brushing it very gently. But salt water is really your best bet if you have a sore. Sometimes you get food caught up underneath your partial. That can cause some irritation. That needs to be tended to. You want to rest your gums, you want to clean it, and help it to heal as fast as it can. All right, so some helpful hints if you have partials is, remember, you still need to go see your dentist. You still need to have a checkup done. You still need to have your cleaning of your natural teeth done. You still want to have an oral cancer screening exam done once a year, at least once a year. You also want to make sure that your dentures are fitting in there correctly, that they're not flopping back and forth. If they're doing that, the clasp may need to be adjusted. You may need to have a little bit more acrylic put in the part that fits onto your gum, so remember that. Put water at the bottom of the sink. Brush your denture with a medium brush, not a very soft, but not too hard either. Still, you want to brush the gums, brush the cheeks, brush your teeth. Do that all very well every single day. That can help keep the bacteria down. Always brush your tongue. That's very important as well, whether you have a partial denture, all teeth, or a denture, a regular full denture. Remember to do that. And remember that loose-fitting dentures are harmful to the tissues that they're resting on. So if your denture is ill-fitting, if it's rocking back and forth when you bite on to chew your food, then you want to definitely have that checked. Now, if you're having a partial made, you can always take a picture of what you look like with your natural teeth, especially if it's in the front, and see if you want to look like you used to. You can see if the dentist can make the teeth look like that. And dentists are really, really good at being artists and making teeth fit to what you're used to. So bring a picture in so that can help the dentist as well figure that out. All right, well, these are three things I want you to avoid on your partial denture, and that would be a whitening toothpaste, vinegar or bleach, and hot water. We already talked about hot water. Okay, that was all I want to tell you. Keep your partials in water when not in use. That was the other thing I wanted to mention to you, because they will have some damage done to them if they're not kept in water. All right, I hope this helps. Becky with Restart Hygiene. Like and subscribe, and I'll be back with more information to help you improve one tooth at a time. Dental hygiene. Thank you.